Phase 1 components include pain control, protection, initiating healing, controlling edema, preventing complications, and maintaining movement and strength in unaffected joints. Athlete can perform ball squeezes to work on wrist and hand strengthening, 3 sets at 1 minute each. To work on wrist and hand strengthening, athlete can also use the web gripper for 3 sets at 1 minute each. Perform gradual elbow passive range of motion in flexion and extension, 3 sets of 10 to help prevent a flexure contracture. Athlete can maintain core by performing posterior pelvic tilts on the physio ball, 3 sets of 20. Athletes should maintain cardio by riding the stationary bike for 15 minutes. Phase 2 components include pain control, increased range of motion, increased flexibility, increased strength, and maintaining cardio. Athletes should perform elbow active range of motion in flexion, extension, pronation, and supination, 3 sets of 10 in each direction. Perform PNF patterns with no resistance to work on functional range of motion. Complete D1 flexion and extension and D2 flexion and extension, 3 sets of 10 each. Perform elbow isometric strengthening with the elbow at 30 and 60 degrees of flexion. Work on the flexors and extensors, 3 sets of 10 each.
Yeah, can you just do the exercises? Yeah, so, yeah. It's not like she's gonna be like, oh, this is exact.
Athlete can maintain lower extremity strengthening by performing 4-way calf raises, progressing from standing on the floor to standing on the AirX pad, 3 sets of 10 in each direction. Athlete can maintain their core by performing crunches, 3 sets of 15. Phase 3 components include continuing pain control, full pain-free range of motion, increasing flexibility, increasing strength, maintaining cardio, and proprioceptive training. Accomplish elbow range of motion and strengthening by performing resisted flexion and extension with the use of a TheraBand, 3 sets of 10 each way. To work on strengthening of the elbow, the athlete can perform manual resisted pronation and supination exercises, 3 sets of 10 each direction. To work on elbow range of motion and strengthening, the athlete can perform clockwise and counterclockwise rotations using the BAPS board, 2 sets in each direction. To work on strengthening of the elbow, the athlete can perform flexion, extension, pronation, and supination exercises with a 2-pound weight. Athlete can then progress weight as tolerated, 3 sets of 10 in each direction. To work on strengthening of the shoulder, elbow, wrist, and hand, athlete can perform rhythmic stabilization exercise, 3 sets at 30 seconds each. Phase 4 components include maintaining pain-free range of motion, maintaining flexibility, maintaining cardio, restoring full function, restoring full strength, and functional activity. To work on strengthening, athlete can use the body blade in a vertical and horizontal motion for 3 sets of 30 seconds each. Also, to work on strengthening, the athlete can perform planks using their hands with a forward, backward, and sideways motion. 3 sets of 30 seconds each. To work on strengthening, athlete can perform press-ups, 3 sets of 10. Athlete can perform plyometric exercises such as a one-handed external and internal rotation using the trampoline, 3 sets of 10 to work on strengthening. To continue lower extremity strengthening, athlete can perform squats on the Bosu ball, 3 sets of 15. Phase 5 includes full function, full pain-free range of motion, full pain-free strength, and full return to activity. To continue working on strengthening, athlete can perform a push-ups progression, including the use of alternating hands push-ups on medicine balls, 3 sets of 10 each. To work on strength and power, athlete can perform overhead throws with the medicine ball, 3 sets of 10. To continue working on lower extremity strengthening, athlete can perform box jumps, 3 sets of 10. To continue strength and power, athlete can perform burpees, 3 sets of 10. Go. To work on speed and agility, athlete can perform cutting drills.